A very good day, my dear postgraduate students, MD as well as dependent. The class for today shall be on the pap smears and the PAPANICOLAOU staining. You are all well versed with the interpretation of these smears, and so the bulk of my class shall be on the technicalities, though a good number of smears are shown for illustration. Nothing much in this particular smear except that the brush should be having a clockwise or an anti-clockwise turn of movements. And here again, there is an IS spatula with an uneven Y-shaped structure so that it fits snugly at the ecto and the endocervix, taking samples from both the regions. The cyto brush, of course, has nowadays come to replace the IS spatula, and either of them are very good in good hands. This is the gentleman, George Nicholas PAPANICOLAOU, who has made a tremendous change in the cervical cytology and prognosis. There has been a drastic drop in the incidence of cervical malignancy because most of the cases were diagnosed at the early stages and an appropriate treatment given. These are the list of headings that we shall be dealing with. Though the pap smear was initially intended for the gynecological samples, it could be very well applied to all the other body fluids, small biopsies, as well as the brushings, etc. I would like you people to kindly go through it, and these are the publications by PAPANICOLAOU in the United States. Along with him, Mrs. Graham was one of the earliest and the most renowned cytologists, and she made the changes, rather observed the changes in the cervical as well as the uterine cells. And in her monograph, The Cytological Diagnosis of Cancer, she has contributed a lot. In fact, it could be said that her work is on par with that of PAPANICOLAOU. A good number of references have been collected from this particular source, and they have been reflected in the article here. There are three main stains that we people should be remembering. In fact, it is not just like hematoxylin and eosin. Here you have got a plethora of reagents which we shall and will remember. Basically, there are three stains. One is a Harris hematoxylin. We shall talk about it. Two is OG6. Three is composed of three dyes, namely eosin Y, light green, and Bismarck brown. The eosin itself is eosin azure, which can be 36, 50, or 65 depending on the concentration. OG6, the examiner had asked, what does OG6 mean? OG signifies orangey, and the word G stands for gelb in the German language. And 6 indicates the concentration of the phosphotensic acid. This is a classical procedure that we are following in our institute. SOP, Standard Operating Procedure. I would like you people to similarly follow whatever is the procedure in your center. So, but kindly go through that. Initially, it is going to be a hematoxylin staining, washing in tap water. Then there is a kind of treatment with the acid alcohol, distilled water, and a bluing. All this is almost similar to the H&E stains. After which you find that the rest of the stains creep in. There is an orange G6 followed by the eosin, which is a counter stain. Also, in a cell block or so, you find that an IHC can also be done. And this is for P16 in the case of vaginal cytology. And these are the components of the others. The orange G6 composed of orange G and then absolute distilled water, phosphotensic acid. And eosin azure made up of the stock solutions, light green and Bismarck brown. So these are the important working solutions and eosin that you people will have to remember. Now look at the brown color over here. I do not know where it is being reflected. but perhaps it is a modern. And the light green, a beautiful color in the renal biopsy that I see on my left, and on my right I find that there is a yellowish orange color of the eosin white. This is a modified procedure in which a gill semetoxylin has been used. All the others are the same. The reference is over here. I would like you people to kindly follow whatever is the procedure that is being recommended and followed in your center. And of course, you people should be able to narrate the reference of it. A series of this one you people already will be knowing, but do remember that hematoxylin, orangey, eosin azure. These are the three important components that we shall and will remember. HSIL. Apart from the other things, I am not going to go into the interpretations of the pap smears. But then there are certain terminologies which we shall remember. There are some cells which are larger, having a large nucleus, maybe an irregular membrane, and probably it is of the HSIL. High-grade squamous intraepithelial lesion. And similarly here also, apart from the pleomorphism, there is a high cellularity, irregular nuclear membrane, hyperchromaticity, etc. that are being identified. And obviously, you people know the conventional, superficial, and the intermediate cells, which are again given over here. There are the intermediate cells, there are the superficial cells, but these do appear different. So, these are the abnormal squamous cells of unknown significance. And if something like this appears, don't ask us, does not ask us. So it can be a squamous metaplasia, or it can be a kind of a drying artifact that can be present. So this obviously you people can make out. It is a malignancy staring at us. I am able to make out a glandular configuration as well as a papillary configuration. It is an adenocarcinoma. And this case happens to be an imprint that has been taken and again stained with the pap smear. So this is a pleural fluid. Always you should remember that it is not confined to the cervix and the vagina, the pap staining. These are the various other regions. One is the pleural fluid. The other things we have mentioned at the beginning itself. For an adenocarcinoma, what can be the features? Papillary configuration, glandular configuration, some among bodies, if you are lucky, increase in NC ratio, nucleoli, presence of vacuoles to be differentiated from the mesothelial cells. Cell within cell. This is one important point. I find that there will be one cell that is engulfing another cell. This will be mistaken for an epithelial pearl and the student will diagnose it as a squamous cell carcinoma, whereas cell within cell is a classical feature of an adenocarcinoma. Artifacts can be present in hobnailing, which is seen to some extent in this smear itself. They are all classical of malignancy. And adenocarcinoma, apart from other things, one thing which is very important will be a three-dimensional test. My professor in JIPMA, Dr. Narasimhan, used to explain papillary carcinoma of the thyroid. It is a three-dimensional cluster, a finger-like projection, which will be blunt. You will not be able to see the edges of it. The chromatin can be prominent and coarse, and the nucleoli will be there. There is a curvilinear border that I can make out in the clusters. Vacuoles, you are lucky if you see them. Tadpoles are classical of squamous cell carcinoma. Elongated cells and then orangophilic cytoplasm. Again, pleomorphism, all the other story fall in place. It is a squamous cell carcinoma. And this is a classical reference for this picture, which is also seen behind my back, courtesy, thanks to them. This is a classical Bethesda system that we are all following. Nowadays, nobody writes a detailed report. But the problem with us is we are going to face the smear in the examination. So I should be able to describe the cellularity, the adequacy, the background, the morphology of the cells, the ratio of the superficial intermediate cells, any other abnormal finding, trichomonas, etc. And if there is going to be a malignancy, describe the cluster of cells that are over there. And incidentally, this is a smear with a drying artifact showing this pinkish and the orangish color in one region, whereas it is less in the others. Classically, drying can be because after collection, it is not put in the fixative, whereas here also, as part of the staining, we allow it to dry. This we have already seen the squamous cell carcinoma and the diagnostic features. Polygonal cells, elongated or tadpole-like cells, pleomorphic insinuation, keratinization, cellularity, and the background. Background is usually cellular with necrotic debris. But this one, it is too very orangish. I cannot say that all are squamous cells, but then this can happen in a case of a radiation. So we should be aware of the changes that a patient can undergo with radiotherapy. Or also this. I find that there are some cells with multiple nuclei which can again be secondary to radiotherapy. Therefore, a direct history and a familiarity is needed very much in this. And now, what are the problems in staining? It can be overstaining or understaining. Poor differentiation. Differentiation means I stain and then I remove the stain from the unwanted components. Hematoxylin is a nuclear stain. I remove it from the cytoplasm. That is called as differentiation. When it is incomplete, it is called as poor differentiation. It can be inadequate also. Bluing, similarly. Whenever there is an acid alcohol, the entire hematoxylin can be removed, but with bluing, the color reappears. So when it is too strong, it becomes too dark. After all this, if the HCl is not removed, there can be the fading of the slide or bleaching of the slide that can take place. After reporting after 2 days, I find it is no longer visible. pH of the tap water, hemorrhagic smears interfere with staining. Air drying, again it can be at the collection or at our center. There is a hazy appearance due to inadequate dehydration also. Lack of the contrasting EA, eosin azure. And cornflakes are artifacts due to air bubbles. I would like you people to kindly memorize all this because it is important in the exam as well as practical day-to-day work. What are the advantages of the pap smear? One, for screening. As I mentioned earlier, there can be a marked reduction in the incidence of cancer. Maturation index, though we are not doing it now, it is a ratio of the cells. I shall be showing you in the subsequent slide. Inflammation, flu cells. Then the various infective agents such as Trichomonas, Candida, or herpes, including human papillomavirus, whereas then there is a large bulging nucleus which can be diagnostic. Metaplasia, ascus, HSIL, these are all parts of the Bethesda system. Malignancies such as squamous and adenocarcinoma. Pregnancy. Pregnancy, of course, it can be made out by this, though we are totally relying on the card method nowadays. Threatened abortion, I shall be showing you a slide of it. Teleotrophy, when there is going to be a suppression of all the cells, superficial, intermediate, and parabasal. Eastotrophy, when there is going to be a persistent but a low-grade hormonal stimulation. Even at 65 years in the patient, you are able to see the superficial and the intermediate cells. Now, what are the technical advantages again? It is well staining for the chromatin. There is a differentiation of the cytoplasm and there is also a transparency. Basically, there are 4 methods or applications for the pap smears. One is conventional. That is what we had been doing. 2 is liquid-based preparations. University question for it. Automation, which we'll have to again mention. And cervical cancer screening, very important because it has reduced the malignancies. There are other stains which can be used, such as Orsin and the Romanowski stain. Orsin stain is mainly used for the maturation index. Also, by means of the Romanowski stains, I will be able to identify the bar body. This is a picturesque view of the epithelium, wherein I find the superficial, intermediate, and the parabasal cells. Intermediate are divided into the large intermediate and the small intermediate cells. So, when the hormonal activity is excellent, all this is reflected. In fact, the vaginal smear is supposed to be a reflection of the hormonal status of the patient. And hence, you are able to make out different diagnoses and you can even date the endometrial cycle. So, progressively, it is getting reduced with the depletion of the hormones. Finally, you get only the parabasal cells in a case of atrophic smear. Now, coming to the indices, this is very important. I would like you people to kindly memorize. Maturation index is the ratio of the parabasal, intermediate, and the superficial cells. Karyotype between the superficial and the intermediate cells. eosinophilic between the eosinophilic and the basophilic cells, folded cell index between the folded and the unfolded cells, and crowded cell index between the crowded cells and the individual cells. So these are indices which are important for hormonal assessment. See what is happening over here. So this is the histology over here. The cells are being shed and you get the cytology. Based on the ratio, you arrive at a kind of a diagnosis. On my left, I'm able to see the intermediate cells. There is a slightly larger nucleus and the basophilic cytoplasm. On my right, I'm able to see the pycnotic nucleus and the eosinophilic one. There is also some amount of drying of the nucleus. So here again, I'm able to see the intermediate cells which have undergone a drying artifact. So this is just to show the ratio. The maturation index is displayed below. This is a totally different picture in which I find most of the cells in the patient are the intermediate cells. Not only that, at the periphery, they show some kind of folding. And these are called as navicular cells, which have got a boat-like contour. Almost all the cells are intermediate cells with folded contour. This is supposed to be diagnostic of malignancy in this case. Squamous cell carcinoma, the reference is given. So in this particular slide, the people are seeing the ratio of the superficial, intermediate, and the parabasal cells. So in this case, the parabasal cells, that's what it means. Okay, this is the maturation index. But then this is a totally different case wherein most of the cells are intermediate cells and some of them are having a folded margin. These are called as navicular cells and it is diagnostic of pregnancy. Navicular means boat-like. This is a wonderful picture. The reference is given over here. I would like you people to kindly appreciate the individual cells as such. In this case, predominantly intermediate cells, some with a folded contour, probably pregnancy. And here again, there can be some hormone-induced changes which people should be aware of. And what are we seeing over here? In this case, I am finding it is, of course, predominantly the intermediate cells. Almost 90% of the cells are intermediate, maybe 1 or 2 superficial. So it is a clear-cut case of pregnancy. But then the same lady comes and at a later date, I am finding that this is the kind of picture. When there is going to be an increased amount of superficial cells in a pregnant lady, it indicates a threatened abortion. Also, this I leave to you people. You try to find out what the diagnosis is. You are routinely seeing it. Probably there is an odd person out. I hope you people will be able to make a diagnosis. And this is a courtesy from exfoliative cytology. I am able to appreciate too many things, including the tadpole cells over here. Sometimes there can be a therapeutic influence also. Nowadays, we are not being given a history, but then these look like dysplastic cells to me. And I may make a mistake unless the complete therapeutic details of the patient is provided. If they have got a hormonal treatment, as in this case, there has been a drug that has been given, it produces such a change. There can be a mistake in the diagnosis. So also over here, the innocent is the person who explains nothing. Therefore, I think we'll be safe if you do complete our report with this. Please correlate with the clinical and the menstrual history, treatment history, histopathology, and the horoscope of the patient. This is what my experience says. Thank you.